again. My name is Kevin Kelly. I'm the head of advocacy here with the NCBI. And over the last couple of weeks, we've been bringing you a series of interviews capturing the experiences of people who are blind and vision impaired during the COVID-19 health emergency in Ireland. Today, we thought we would do something a little bit different, and we would go to the other side of the world and check in with Vision Australia. And I'm delighted to say I'm joined on the line by Karen Knight, who's the General Manager of Vision Australia's Client Services. Karen, thanks for joining us here on NCBI's podcast.
Thanks very much for the opportunity. It's a great honour.
Karen, so tell us a little bit about how things are in Australia at the moment.
Well, actually, I think Australia as a country is doing fairly well in terms of flattening our curve. Certainly, everyone is working from home. People are only allowed to go out to get essential items such as groceries or go to the doctors, or they're allowed to have one visitor to their house, but they have to stay in their local neighbourhoods and can go out for exercise. But there's very, very definite signs for us that we are flattening the curve. And in fact, in Queensland for the past week, there's been new cases in single figures only each day. And in fact, there's only been about 64 people in Australia who have died of COVID-19. So that's really 64 too many, of course, but it's a fantastic outcome so far.
That sounds exceptionally positive, and some of the restrictions that you mentioned there are quite similar to what we've been living with in Ireland over the last number of weeks. I suppose turning to the bread and butter, both for NCBI and Vision Australia, how have things been for people who are blind and vision impaired?
It was really difficult for people to get used to the circumstances as they change quite rapidly. Particularly accessing the shops and getting groceries was a real challenge. Many people who are blind or low vision, I guess, like in Ireland, have obtained their food each week via online shopping. And you'd think that'd be just the right thing to do in these times. However, supermarkets stopped delivering. They couldn't keep up with people that wanted delivery. So they said, no, we're not delivering. And of course, that threw people into a spin, particularly people who are blind or low vision. It took supermarkets then a week or two to find ways that you could indicate that you needed special assistance and that you really didn't have any other option than getting your food delivered as a result of an online order. And so it was those couple of weeks that were really tricky. Once the supermarkets got their system sorted out, it improved somewhat. They also introduced, the supermarket said that people with disabilities could come to the supermarket an hour earlier than the general public, and that they were hoping that would be a way that people with disabilities and their carers could access supplies earlier than others. And people were panic buying, as I think they were in lots of other parts of the world, and some essentials such as toilet paper were really hard to come by.
Indeed, toilet paper was a real issue in Ireland in the early days of the crisis, and it's something that we have in common, because access to shops and supermarkets has been a real challenge for people in Ireland who are blind and vision impaired. And whilst there's been some progress in having people who are blind and vision impaired included in dedicated shopping hours, supermarkets here on the whole have failed to put anything in place to prioritise orders for people who are blind and vision impaired.
Yes, and that would really create a lot of very stressful situations for people. And I can imagine that you've probably had lots of calls from your clients who are very stressed by that situation.
Exceptionally so, and I think the other thing that this is really highlighted for some people who are blind and vision impaired is the world as we know it is everyone's moving online, but I think it's really accelerated the move online, and some people are really struggling with that adjustment.
They really are, and so we've been doing whatever we can to help people achieve getting online, recognizing that some people don't even have the equipment to get online. So some of our services we have changed to using the telephone, assuming that most people do have a telephone in their home. We're doing whatever we can by telephone. And then we're using telehealth, so Zoom platforms. Sometimes we use FaceTime platforms to connect with people, because we thought it may not be a traditional service that we're able to do, although more and more we are now as we've got practiced over the weeks. But it's about staying in touch with people. It's about connecting with them often and trying to link them to community resources where that might be able to help them. So we actually set up a COVID hotline that clients could call and talk about their situation, and we would link them with a resource in the community that could help. Or if there truly was no resource in the community that could help, then we would send, with the correct risk assessments done, we'd send the staff out there to support people.
We've done something similar in Ireland by launching our national helpline, and there's been a wide array of calls coming in. But one of the themes that we're really picking up on is that there are a lot of people out there who are really feeling quite distant and isolated from society and services. And I suppose that's something that people who are blind and vision impaired sometimes can struggle with before the onset of COVID 2019, but it's becoming really apparent in the calls that are coming through to our national helpline. Is that something similar in Australia?
Yes, indeed. Certainly, isolation and social isolation is a big issue for people who are blind or low vision at any time, and this has been magnified. We have found some situations, though, where there were people available, whether it's a family member who's normally at work or people that had a bit more free time than they otherwise would have, that have helped relatives who are blind or low vision to access the technology. For example, help them get online with Zoom or with FaceTime to connect with others. So we have found some of those stories, but yes, certainly isolation is a big issue, and people have had so much more time on their hands, and we've been encouraging them to connect with our library service, to read more, to connect with telelinks with friends, and to just really keep that social connection with the community wherever they possibly can.
Yeah, and we definitely encourage anyone listening to this to reach out to NCBI's national helpline on 1850 33 43 53, and we can link you in with an array of services, because there's lots of things happening out there at the moment that people may really find useful and beneficial at the moment. Another issue that as we move into a phase now in Ireland where it looks as if we're going to be easing government restrictions in the days and weeks ahead is obeying social distancing guidelines and saying 2 meters apart. That's a real challenge for people who are blind and vision impaired.
That is tricky, isn't it? So sighted guide is the main way in which people move around the community if they're being led by someone, and social distance really isn't possible in that true sense of sighted guide. So we have talked about ways that we might be able to do that, encourage people to sometimes use their cane independently if they have good enough cane skills, where they can just follow someone. If they have a dog, then the dog will follow. Some people have actually, when, as you probably know, Kevin, when people who are blind or low vision run competitively, and even if they want to run for exercise, they sometimes use a rope that has a handle for each person to hang on to so that they can freely use both arms. I think some people have been trialling that. Some people have also used a fold up cane and held both ends of the cane as it's folded up to have that connection. But as you know, that's a lot of these things aren't particularly good, because you can't feel what the arm is doing. You can't feel the information through the elbow that you would normally feel. So we do try to encourage people, if they want to use sighted guide, make sure you follow hygiene measures and use sanitizer. Both people use sanitizer regularly.
Yeah, I think there's some really sound advice there in what you have said, and people are having to adjust and do things differently, and people who are blind or vision impaired are no different in that way. And I think this crisis is, in some cases, making people really dig into their own personal resolve and be brave and maybe attempt things that they wouldn't if the crisis wasn't amongst us in the country.
That's right. It really does test people's resilience. And sometimes because people have a bit more time on their hands, it can be a good time to try and learn some new skills if you feel that you've got the capacity to do that. It I think the other thing is that people who are blind or low vision often touch surfaces a lot more. So following hygiene measures is just so important.
It really is, and I think that's something where some of our advocates have really highlighted to us in the various meetings and engagements we've had online in the last couple of weeks, is that kind of tactile elements that they feel more nervous and apprehensive about feeling surfaces. But we've been trying to reassure them, if they follow the guidelines by the health authorities around hygiene, that they will be okay.
Yeah, yes, and that's what we've been saying too. Listen to what health authorities are saying and follow that. And as an organisation, we're certainly using that as our guidance about what services can operate and how they can operate.
Yeah, something that I'm curious about, and it hasn't been happening in a widespread fashion across Ireland, but we have been receiving some reports from service users where members of the public have been quite impatient with them when they haven't been obeying social distancing, or in the case of our service users who have guide dogs, people have been passing comments about the dogs potentially passing the virus, which is completely untrue. And we've done some
Mm.
work with our colleagues in Irish Guide Dogs to highlight this fact. Is that something that has cropped up in any way in Australia?
We have heard people being abused by other members of the public around not maintaining social distance, and particularly people with dogs not maintaining social distance. The dogs aren't trained to do that, so it really is a matter of trying to give people the advocacy skills to explain to members of the general public why that might be the case, and that if someone is blind or low vision, you often actually don't know quite how close someone is to you, and that can change on a moment by moment basis.
Mm, very true. And Karen, just to wrap up our interview, we live in unprecedented times. Have you got a sense, as client services manager with Vision Australia, how you will roll out services in the months ahead whilst we live with the virus and in the absence of having a vaccine?
Yes, I think we will be doing more and more telehealth services. That doesn't mean to say that as things ease a little bit, we'll do some face to face services whenever it's possible. But we certainly won't be travelling the way we used to around various parts of the country for for some time to come. We will be encouraging people to continue to work from home a lot of the time, and we'll be developing people's skills in delivering telehealth. And we've been doing some really exciting things about how to deliver O&M services over telehealth, as well as occupational therapy and some services for assistive technology over technology as well. So it is a new era. It's something that we've dabbled in a little bit previously, but we really had to double down on it and build our skills to make sure there was a whole plethora of services that people could access. And we'll be doing that more and more into the future.
Indeed, and I think that'll be the same for NCBI. That was me, Kevin Kelly, in conversation with Karen Knight, General Manager of Client Services with Vision Australia. I hope you found that really insightful and entertaining, and gives you a sense of perspective around how things are in another country outside of Ireland. As I said, NCBI's national helpline is available on 1850 33 43 53, and you can visit our website for further information.